So we're going to conclude this portion of the meeting, I guess, and then we can set up some lines so that with social distancing, people can go through the truck to see what it's like, and then I'm happy to answer any questions. Thank you very much.
Thank you all. Thank you.
We'll head outside and take a look at the mobile unit that will be used for testing and vaccinations. Just give us 1 minute and we'll head outside to the mobile unit, so stay with us. Sheena, it's going to be for vaccinations and testing, or just, yes, okay. And just heard from a couple of our state legislators, as well as Dr. Lin from LECOM Health, announcing a mobile vaccination unit that will be used for up to 2,500 vaccines a day or more, depending on how many vaccines are made available to LECOM. And this unit will be made available to the public. It will come to groups to be used. So we're going to take a closer look here before we sign off at this mobile unit. And this mobile unit here, it looks like the testing will take place on the front side of this. And of course, it's an all-in-one unit. Can you give me a quick tour for Go Erie Facebook? Is that all right?
Absolutely, yeah.
All right. So this is
I'll meet you around.
yeah. And this is an all-in-one unit or a trailer?
This is all one unit.
All-in-one unit. All right, very well. So it looks like you just walk up to this, and we're going to get a quick tour here before we sign off of our Facebook Live for today. And great, right here. All right. Can you tell me your name and
Yes, Jim Caputo.
Jim Caputo, and what's your title with LECOM?
With LECOM, I have a few different roles actually. I'm
That's
the
all
director
right.
of the laboratory facilities, and I'm also the coordinator for rapid response
Great.
deployment out in the 7th County.
Tell us what folks will see and how this will work, please.
So these particular machines, there are a number of different modalities that we actually use for testing. This is what's called a PCR or a mini PCR type display. This is the Abbott ID Now. These are able to return results in about 15 minutes.
15 minutes.
Yeah, about 15 minutes. This is around, so this is the assay that uses itself called ID Now. This is a nucleic acid type test. There are antigen test and nucleic acid.
So tell us how the whole unit will work as somebody comes up to this unit.
So if someone comes up to this unit, they will actually be able to be swabbed, and depending on whether they would be able to.
And they'll walk right up to where you are here, is that right?
Correct.
Okay.
So they could be swabbed either in this area, or if we were concerned about someone being infectious, we actually have the ability to swab them without any sort of contact as well. A sample can be placed inside the sample well by that person, and then retrieved on the other side by the individual in the sample.
Okay. How does, by the way, how does some elderly or handicapped disabled person take advantage of this unit?
Yeah, and that's one of the areas that's a little bit more difficult to work around. We have the ability to move and mobilize these machines into whatever area we're in.
Okay.
And that's typically what we've done, is we've actually taken our units, not only can we keep them mobile, but these are very rapid setup machines, so we're able to set up a whole bank.
So, and this is testing and vaccinations, or just testing?
This is the testing component of it, but we have the ability to administer vaccinations through this.
Okay.
Through this machine.
So the testing results can be done in 15 minutes, and the vaccinations can be done on the spot, is that right?
That's correct.
And then, am I right that Dr. Lin said that you can do up to 2,500 vaccinations a day if you have enough supply?
He said 2,500 a week.
A week, 2,500 a week with enough supply.
With supply, and actually we can gear that up. We're set at a rate where what we can typically do with the, for example, with the crew that we have right now, we would anticipate that we could do on the order. We typically immunize about every 2 minutes for every vaccinator.
Okay.
So right now, for example, we have 4. So essentially, we could end up.
Anything else that our Facebook Live audience needs to know, just the basics about how to take advantage of this mobile unit when it's in their community?
That's a great question. I'm gonna relate to the people that make.
That's fine.
decisions on that.
Thank you for the rundown.
You bet.
All right.
Sure.
Okay, folks, so that's a quick rundown of how this unit works. And again, you should see this in your community soon. I believe starting next week, they're going to have this in place. Mobile testing and vaccinations, 2,500 vaccinations per week, or possibly more, depending on how many, the kind of supply that they get. This is Christopher Millett, News Director for Erie Times News and GoErie.com. We'll be signing off now. Please return to GoErie.com for more information about this development. Thank you.